Hi, I'm Russ Graney. This is Mike Galbo. I'm a former Bain consultant and most recently the founder and leader of a charter school in Bed-Stuy, Brooklyn. Mike's an energy engineer by training. This is the second startup he's working on, and we are building Aidin. So I had an experience with my family last summer. My uncle was in the hospital and needed a place to go after he left. And we took us 17 phone calls and 5 faxes for us to find the right post-acute care for him. And after doing some research about it, Mike and I realized that there's actually 9 million families who go through this similar experience every year. So Aidin is a platform that connects hospital discharge planners and patients to quality post-acute care with the aim of reducing length of stay in the hospital, improving the quality of care that patients can receive, and giving patients more agency and choice in the whole process. Mike and I are members of Blueprint Health, which is a health tech incubator here in New York City, the first of its kind. So we're really proud to be here in New York, working with 8 other teams to reinvent healthcare. Yeah, so the key benefits of Aidin from the hospital discharge planner perspective are, one, that we're giving them access to all the providers in the area quickly and efficiently. So we're electronically tied in with all of the providers in the area, and our process makes it as easy as Gmail to send out a request to all of those providers and to hear back from every single one so that you have all the choices available. The second piece that we're doing is providing patients and discharge planners with quality ratings based on 3 million previous patients' experience with these providers. So that information currently very difficult to find and use, and we're bringing it right to the user right when they need it. The third benefit that we're bringing to hospitals is that we've realized that currently it's very difficult to manage the discharge planning process. So there's lots of different social workers working very hard to work with all of their patients, but there's no tool that helps managers view all the patients on the floor, see where their status is versus where it should be, and to see the various performance ratings of their social workers. So we're building into our product a dashboard that gives managers insight into all of those things so that you can intervene when a patient's behind schedule, and you can coach your teammates to make sure that everyone is performing at the highest possible level.
One thing I would also mention is Russ and I have spent a lot of time talking to people in hospitals, but also people who have had previous experiences with their family members, people who have been in that hospital situation where they don't know where to go next. And I think that's the thing that Russ and I really identify with. It's families, patients who are struggling to find the quality post-acute care that they need and are not sure where to turn to.
So currently, Aidin is in early development. We're speaking with a lot of people in hospitals, discharge planners, patients, hospitalists, as well as leaders of home health agencies to learn more about the space and to make sure that Aidin is really solving people's most pressing issues. So we have a live demo that we've been shopping around with different folks, talking about the product, talking about our process. And our plan is in the next 3 to 4 months to go live with a private beta, and by the end of the year be working in 3 to 4 hospitals with helping patients find the right care for themselves after it's time to leave. So you can learn more about us at www.myaidin.com.
That's spelled A-I-D-I-N.
A-I-D-I-N, that's right. And we're really excited to be presenting this coming Monday at the Health 2.0 meeting up in New York at the DNA of New York.
Awesome. Okay. Thanks, Russ. Thanks, Mike.
Thanks.
Excellent.
Thank you.
Appreciate it.